Hello and welcome. My name is Holly and today I'm going to be teaching you about nursing care plans. So if you're in nursing school and you want to create awesome nursing care plans, then this is the video for you. Alright, so like I said, I'm going to be giving you a step-by-step guide on how to create awesome nursing care plans. So this step-by-step guide has 5 steps in it, so I hope that you will follow with me through each step so that you can get on to creating awesome nursing care plans. Let's get into it. Alright, so step number 1 is going to be to assess your patient. Very obvious, but it has to be done. So you're going to want to do a very thorough head-to-toe assessment. If you're in your first semester or your first level of nursing school, you may not really have the rhythm down, or you may not know how to classify something, but that's okay. Just do your best. If you come across something, if you hear something funny in their lungs but you don't know what it is, just ask your nursing instructor or the nurse that's taking care of that patient or another nursing student, and do your best, but get as much information as you possibly can in that head-to-toe assessment. And then we're also going to want to take a look at their electronic health record so that we can look at their medication profile, any PRNs that they are continually having to have, like pain medicine or nausea medicine. We're going to want to know that. And then you're also going to want to take a look at your labs. The best way to think about this is like you're a detective and you're trying to build your case. So you want to get as much evidence as you possibly can. The more that we have to work with, the better off we're going to be. So gather as much evidence as you possibly can, and then we can move on to step number 2. Alright, step number 2 is going to be to create your diagnosis. Now when I say diagnosis, I don't mean medical diagnosis, and you probably know this, but it bears repeating. As nurses, we cannot give a medical diagnosis. We use what are called nursing diagnoses. Say that 5 times fast, right? And these nursing diagnoses have 3 different parts that we are going to put together and create. So we have the problem, the etiology, and the signs and symptoms, and we're going to go through each of those. Alright, so for illustrative purposes, I'm going to pop up some patient information that I made up so that we can use this as an example when we're going through our care plan. So I want you to take a look at it, kind of read over it for a minute, and maybe start formulating what nursing diagnosis you think we should use for this patient. Okay, so we're going to use this assessment information to create our nursing diagnosis. And the first thing we're going to do is identify a problem. So in order to create our nursing diagnoses, we have to use what are called NANDA approved nursing diagnoses. And I will put a link to NANDA I's website. They actually changed their name, so it's not just NANDA, it's NANDA I to be international. We have to have a book like this one, or you can use online resources, but I really like using this nursing diagnosis handbook. Oh, that's embarrassing. You didn't see that. Okay. I like using this nursing diagnosis handbook to create nursing care plans. It will literally almost write it for you. So you want to use one of these. It has really all the information that you could possibly want for your care plan, and we're going to use this to find our first part of our nursing diagnosis, which is our problem. So if you will refer back to the information, the assessment information that we had on our patient, you will notice that in the history it says that they have CHF, and it seems as though they're presenting with some signs and symptoms of that CHF. So let's go ahead. Let me take that wrapper out of there. Okay, that's gone. Okay, so what we're going to do is we're going to go into our book and we're going to look under the section, brief pause. If you haven't already, I have a blog post on my website that tells you how to use one of these nursing diagnosis handbooks. So if you don't know how to use one, I highly recommend you go and check out that blog post, because like I said, these will write your care plans for you. So we're going to go to this section. It's called the Guide to Nursing Diagnoses. All right, and under here we can actually search for a disease process. So we're going to do CHF like I said. So we're going to go to the C's and we're going to find CHF. Here it is, congestive heart failure. I'm hoping that you'll be able to see it. If not, I will make sure to take a picture and put it up there. Okay, You see here it says CHF, and right here there's a list of problems. I will read a few of them off to you. We have activity intolerance, decreased cardiac output, fatigue, excess fluid volume, impaired gas exchange. These are potential problems that your patient could be having if they have CHF. Now what we need to do is figure out if any of these are appropriate for our patient. Okay, so thinking back to our assessment information, let's see if any of these are appropriate. So here we have constipation related to activity intolerance. So the problem would be constipation. Well, our patient told us that they had a bowel movement that morning and that it was regular for them, normal consistency. They normally go every day and they haven't had any problems with their bowel movements. So I'm going to say that constipation, even though it's under this CHF problem list, it's not an appropriate problem for our patient. Let's try another one. All right, so next one that we can try is excess fluid volume related to impaired excretion of sodium in water. Well, if I remember correctly, our patient actually does seem as though they have an excess amount of fluid. They had that pitting edema, that extra fluid in their lungs. Remember there was that frothy sputum? So I'm thinking that we could actually use excess fluid volume as our problem. So we've got that first part of our nursing diagnosis. So far we have our problem equals excess fluid volume. So as you can kind of see here, we went through this list of problems that were under CHF. Not all of them are applied to our patient, so you can't just pick one off of these just for funsies. You have to actually pick one that's based off of your assessment information, and that's very important, so I wanted to make sure I made a note of that. But now we can move on to the second part, which is the etiology or the related to. Okay, so this related to portion is basically saying, why is this problem happening? What is, in our instance, the excess fluid volume related to? Like, why is it happening? What's going on in the body that's causing the excess fluid volume to be present? So the way that we explain this is in terms of pathophysiology, your favorite thing. So the way to kind of think about this is that you're taking the medical diagnosis and explaining it into more simple terms. So we know that he has CHF, right? Congestive heart failure. Well, what is a really simple but medical sounding way that you would describe that? How about that the excess volume is related to decreased cardiac output and backflow of fluid into the lungs? Sounds pretty good to me. All right, so we have our first two parts of the nursing diagnosis. We have our problem and our related to. So I'm just going to read that off briefly. If you'll excuse me, I'm going to be looking away from the camera. So far we have excess fluid volume related to decreased cardiac output and backflow of fluid into the lungs. So now we're going to move on to our signs and symptoms, or our as evidenced by. So the last part of the nursing diagnosis, the as evidenced by, or the signs and symptoms, is basically your evidence, right? It says as evidenced by. This is how you're supporting your claim that the patient has excess fluid volume. How are you going to prove to somebody that your patient has excess fluid volume? We're going to use the assessment data that we have that supports that claim. So for instance, someone who has 3+ pitting edema, that is evidence that they have excess fluid volume. Or if they have crackles in their lungs, or if they have a congested cough, that's indicative that they have extra fluid in their body, and we can use that to support our claim. So always make sure you go through all of your assessment data and pick out the signs and symptoms that support your claim. You can put as much evidence under there as you can, and in fact the more the better, because that's actually substantiating that claim. So let's go over the signs and symptoms that we can use to support our claim that our patient has excess fluid volume. Okay, again, I'm going to be looking off screen because there's quite a few here. So we have crackles throughout all 5 lobes, a productive cough, +3 pitting edema to bilateral lower extremities, faint pedal pulses associated with that pitting edema. We have our patient is on Lasix 40 milligrams daily, and we have dyspnea upon exertion. all of those pieces that we assessed for or that we found in the electronic health record are going to support our claim that our patient has excess fluid volume. Okay, so we got our problem, we got our related to, and we got our as evidenced by. So now we can put it all together. So we have as our nursing diagnosis, excess fluid volume related to decreased cardiac output, backflow of fluid into the lungs, as evidenced by crackles times 5, productive cough, +3 pitting edema to bilateral lower extremities, faint pedal pulses, Lasix 40 milligrams daily, and dyspnea upon exertion. That is our nursing diagnosis. And we're done with step 2, and we can move on to step 3. Okay, so step 3 is going to be our planning stage. This is where we're going to plan out our goals for our patient and our nursing interventions. So we know that our patient has excess fluid volume. What would be a good goal for this? We obviously don't want them to have excess fluid volume, so what are we hoping for them? What is our goal going to be for them? And also, how are we going to achieve that goal by way of nursing interventions? Let's address. Okay, so for our goal, basically you want to think about it as the opposite of what is currently occurring. So what would be the opposite of excess fluid volume? Well, that would probably be deficient fluid volume, and we don't want that, but we do want our patient to have a fluid balance, which is kind of the opposite. So it's not exactly, but sometimes you can look at it that way. Now, remember how I told you that this nursing diagnosis handbook can really write these care plans for you? Well, we're going to go to the page that has our problem on it, which is excess fluid volume. And down here you can see, sorry, this is kind of awkward here, that they have recommendations for the outcomes of a patient that has excess fluid volume. And here you see that the goal that they have planned for them is fluid balance. So you can actually use this book to find out what your goal could potentially be for your patient. This book is amazing. Okay, so we can say that our goal for our patient will be fluid balance. Now, just as we do with our nursing diagnosis, we also have to have a way of proving that our patient now has a fluid balance. So we're going to list the as evidenced by, just as you do with the nursing diagnosis, but this time it's going to be to substantiate the fact that they have fluid balance. So how might we know that a patient has fluid balance, or how might we know that our patient is now being shifted towards fluid balance as opposed to fluid volume excess? Well, we're probably going to find that they don't have that edema in their legs anymore. It may not be completely resolved, or maybe it's just decreased. So maybe they have +1. Maybe they don't have that cough anymore. Maybe they don't have to take Lasix all the time anymore. And we can also say that we can finally feel those pedal pulses right now that that edema has gone away. So we can say that our patient has fluid volume as evidenced by, the no edema, you can feel the pedal pulses, and there's no more productive cough. Next up is going to be the nursing interventions. This is where you're going to plan out what you would actually do for your patient that had this problem. So you've created this whole nursing diagnosis for them. You know what their symptoms are, and now you're going to figure out what it is that you're going to do as a nurse to help them. Now again, this really awesome handbook here actually has nursing interventions. Now, let me be clear and say that not all of these are going to be appropriate for your patient, but they can give you ideas of what to do. So let's just, for instance, read this first one. A nursing intervention here that they have would be to monitor location and the extent of edema using the 1+ to 4+ scale to quantify edema. Also measure the legs using a millimeter tape in the same area at the same time each day. And then it also offers you the rationale. So it has causes of peripheral edema in patients with heart failure are related to medications, compensatory changes that influence hydrostatic pressure and fluid retention, among other things. So there's a whole list that you could go through. You could pick the ones that seem appropriate for your patient, but you're going to plan out what it is you're going to do for your patient to help resolve their issues. One of the awesome things that you can do if you've looked at the medication profile, which you should have, is look through those and see which one of the medications would be that you would give your patients to help them with that issue. Now, we saw that our patient was taking Lasix 40 milligrams daily. You can actually use that as a nursing intervention. You could say the nurse will administer Lasix 40 milligrams BID. And that's a nursing intervention. But you're going to plan out what it is you're going to do for your patient. And whenever I was in school, we had to do 10 nursing interventions per problem. I don't know if that's what every school does, but that is what we did. So sometimes you do kind of have to get creative, but you can come up with 10 nursing interventions, especially if you're using this book. So as I mentioned, this book has rationales for each of the nursing interventions. So a lot of times your instructors will want you to explain why it is that you are doing that. So for instance, with the Lasix, when we know that Lasix helps the patient diurese and get all that excess fluid off, so you would put that as your rationale. And you can, for the most part, I think you just put it in simple terms, explaining why it is that you are going to implement that particular intervention. Next up is step 4, and that is going to be implement and evaluate. Now I have these in the same step. They're not necessarily the same step, but I'm putting them in the same step because you're going to then implement, hopefully, those nursing interventions. So if you have the same patient the next time you go to clinicals, you can use those nursing interventions and see if they work for the patient. Now, we don't always get to do that, so sometimes you will just have to work with what you got, and that's okay. But we will implement those, and then we will evaluate their effectiveness. And the way that we evaluate them is by labeling them as met, partially met, or not met. So let's say, for instance, the patient that we have them over a course of a few weeks. And let's say after 1 week, we notice that nothing has really changed, right? Like they have all the same problems that they had. They still got the crackles, the cough, the edema, all that is still there. We would say that our goals of them having a fluid balance was not met, right? Because we're not making any progress. And we'll have to readjust. Maybe we need to try new medications. Maybe we need to put in some new interventions. But we're going to label it as not being met yet, right? Let's say the next week we notice that they're clearing up a little in their lungs. They still have some edema. It's like 2+. And like you can kind of feel their little pedal pulses coming up, and they haven't been coughing, but they still are having a hard time getting around the room. They still have that breathlessness and that dyspnea upon exertion. We would say that that goal was partially met, right? Like we're kind of there. We're not there all the way, but we're making progress. We could say that that was partially met. Now let's say 3 weeks later, your patient about to go home. They're clear in the lungs. They got no edema. They can walk around the room. They're running circles around you, right? Pedal pulses, strong, good to go, everything peachy keen. Well, at that point, we can say that the fluid balance goal has been met. Now, I know that we all want that met goal, right? As nurses, we want to fix our patients. But we're not always going to get that, and that's okay. Sometimes you're going to have a patient that none of the goals are met, especially if you weren't able to implement any of your nursing interventions. Then we may see that none of the goals are met, and that's okay. But you just want to go through each goal and identify them as either being met, not met, or partially met. All right, step number 5 is going to be to prioritize. Now, in this video, we have only created one nursing diagnosis because it would probably be like a 3-hour-long video if I actually did like 5 to 7 nursing diagnoses like most schools want you to do. But whenever you're creating your care plans for your patient, you're going to probably create like 5, I would say. Depends on your nursing instructors and the school that you go to. Let's say that you have 5 nursing diagnoses that you have to create. Well, we're going to need to prioritize them. So which one of those is the most important, and which of them is like important but not as important, right? Prioritization. Okay, so the way that we typically want to prioritize is by using our ABCs. So we have airway, breathing and circulation. And you kind of will get the hang of this as you do it. Sometimes it can be difficult to know which one's the most important, but you can use that ABC, airway, breathing, circulation, to help guide your prioritization process. Okay, so I hope that this was helpful for you. I know that we kind of covered a lot of different things and you may be confused about some of it, but I highly recommend that you check the links that I'm going to put in the description. I'm going to link the original blog post that I created. It contains the step-by-step guide for nursing care plans. It might make a little more sense to you if you're able to read it instead of hearing me talk about it. Not always the most eloquent, so you might want to check that out. Then I also have a post about the nursing process. If at any point you were confused about some of the terminology, you might want to check that out. And then, like I said, I have the post about this beautiful nursing diagnosis handbook. I'm telling you, I think that maybe I will do my next video on this, because this is such a godsend whenever you're creating nursing care plans. All right, so if you made it all the way through this video, I surely appreciate your time. And since you've made it this far, you might as well go ahead and hit that little subscribe and that little notification bell so that you can get all this nursing goodness. And also, while you're doing that, if you wouldn't mind, drop in a comment down below of your biggest care plan tip that you would give to a nursing student. I'm sure there are other nursing students out there that would love to read them. Until next time, happy nursing!